Hello and welcome to yet another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong. In our previous episode, we talked a little bit about the 4 most common scarring alopecias or cicatricial alopecias that we see at Terra Medical. And in this episode, we're going to go on a little journey deeper into the topic of scarring alopecias, and we present to you an FAQ on scarring alopecia. So in clinic, we have to make a decision together with patients depending on what type of scarring alopecia or cicatricial alopecia they have. We usually start with a course of conservative management. We try to improve the appearance of their hair by using things that stimulate hair growth like minoxidil. There's strong evidence to suggest that dutasteride and finasteride do help these conditions. We also treat the symptoms that they experience in terms of burning, sensation or pain or itch in the areas by using the correct type of shampoo, the correct type of scalp care, and if there's a need to, using immunosuppressants to reduce the inflammatory response. And if you're afflicted by something like folliculitis decalvans, antibiotic course will definitely be recommended to make sure that the folliculitis is kept at bay so that we can actually go in and repair the scarred area. And some practitioners, maybe overseas or if you've Googled, they might recommend you to use a regenerative process called PRP or platelet-rich plasma injections, and these are injected into the scalp after extracting some blood and spinning it down. So we just want to highlight that this procedure is not available to us in Singapore. It's not an approved procedure for hair restoration treatments. So the prognosis of your condition of scarring alopecia depends largely on a few things. One is if this is rapidly progressing or not, and it varies from person to person. And if there's continual triggers, such as if you're continuing to apply offending agent like sunblock into the hairline, or if you're continuing to have this autoimmune process that's ongoing and untreated, then the progress of the disease might continue and the prognosis will be poor. In most situations, we don't expect hair to regrow from the scarred areas, so that limits what we call the regrowth prognosis, but we certainly can limit the damage of the scarring alopecia by using various medications. The long-term outcome of these conditions really depends on when you've first noticed this condition and whether you're doing anything to help stop it from getting worse. But there is no known cure to say. There's no magic tablet or vaccination that you can do to stop this from ever happening to you or to stop it from progressing. It requires continual monitoring and treatment, and if you wanted to recover the hairs that are lost in that area, a hair transplant would be the only way to do so if you are a suitable candidate. So I think the first question you want to ask is, what is your experience with treating such cases? So there are certain doctors that are hair focused and certain doctors that focus more on aesthetics and skin, and there are certain doctors that do a range of procedures and very experienced in both. And this question with regards specifically to scarring alopecia could be very crucial to determine your success in getting good treatment, prompt treatment and the correct advice. Other questions include, are you sure about my diagnosis? So the only confirmatory test is a biopsy, and a biopsy will give us definite answers as to whether this is truly a scarring type alopecia or cicatricial alopecia. Third question I would ask my doctor is, are you expecting this to progress quite quickly? Also, how do we monitor my progress in terms of whether I'm improving or getting worse, or is this going away very quickly, or is this something that will stop there and all I need to do is get a hair transplant? So I would ask my doctor what his treatment plan is and how he plans to monitor me. Lastly, I would like to ask my doctor if he recommends any lifestyle changes that I should make. For example, if we should change the way we apply our sunscreen products or choose a different kind of sunscreen in the context of frontal fibrosing alopecia. So in solving the scarring alopecia puzzle, it involves multiple steps. The first step is to get an accurate diagnosis. We want to make sure that the disease is not progressing. We want to make sure that it's stable for at least 2 years before even considering a hair transplant in the context of frontal fibrosing alopecia or LPP. In the context of FAPD, it would be the case where it is quite unlikely to be transplantable. And some patients might ask that, is there a role for doing regenerative treatments like PRP or Regenera AMT? And this depends on whether or not there's concurrent pattern hair loss, whether there's miniaturizing hairs, which PRP can have the potential to benefit. But if there's not, and it's mainly FAPD as a primary pathology, then you would likely see minimal benefit from PRP. It's worth highlighting again that PRP is not an approved process in the Republic of Singapore, as governed by the rules set forth by the Ministry of Health Singapore. Thank you for your kind attention. If you liked our content today on scarring alopecia and you have more questions to ask, please leave them in the comment section below. Don't forget to click like and subscribe to our YouTube channel for more hair loss information and more information on hair related disorders.